You've probably walked past these foods in the grocery store 100 times without giving them a second thought. And honestly, I get it. They don't look exciting. They don't come in flashy packaging. They don't promise miracles on the label. But here's what surprised me when I started digging into the research. Some of the most boring-looking vegetables and spices on the shelf have some of the strongest evidence behind them for helping your body handle blood sugar better. Not in a magical way, not overnight, but in a steady, realistic, science-backed way that actually fits into normal life. And if you're dealing with diabetes, prediabetes, or stubborn belly fat that just won't budge, this matters more than most people realize. Look, here's the thing. Most people focus only on sugar and carbs. They forget that blood sugar control is about how your cells respond to insulin, how fast glucose moves from your blood into muscle, and how much inflammation is quietly interfering with that process. And this is where certain foods punch way above their weight. One of the most overlooked is bitter gourd. Yeah, I know, the name alone doesn't sell it. But this vegetable has compounds that behave in ways that look a lot like insulin in the body. That doesn't mean it replaces medication. It means it can support the same pathways that medications try to influence. Bitter gourd has a very low glycemic impact, which means it doesn't flood your bloodstream with sugar after you eat it. What's more interesting is what it contains inside. Compounds like charantin and vicine have been shown in lab and human studies to improve glucose uptake into cells. In plain English, they help sugar get out of your blood and into the tissues that actually need it. That's huge for people who feel like their blood sugar spikes no matter what they do. Add to that its vitamin C content, which helps protect blood vessels from oxidative stress, and minerals like potassium and magnesium that support nerve and muscle function. Over time, those small effects stack up. That's why people who regularly include bitter gourd in meals often see modest drops in fasting glucose and waist size. Not because it's magical, because it nudges several systems in the right direction at once. Now let's be honest about the taste. Raw bitter gourd can be intense. That's why the best approach is gentle cooking. Light steaming or quick sautéing keeps most of the beneficial compounds intact without turning it into a punishment meal. Pairing it with protein like eggs or yogurt slows digestion and makes the blood sugar response even smoother. You don't need huge amounts. About a cup a day is enough to get the benefits without upsetting your stomach. And if you're on medication, this is one of those times where it's smart to check your readings and talk with your doctor. Because combining food and drugs that both lower glucose can sometimes push things too far. Another vegetable that gets criminally underestimated is spinach. People think of it as just salad filler. But nutritionally, it's doing a lot behind the scenes. Spinach is loaded with magnesium, and magnesium plays a direct role in insulin sensitivity. Low magnesium is linked to worse blood sugar control and higher blood pressure. Spinach also brings fiber into the mix, which slows how fast glucose enters the bloodstream after a meal. That's why people who eat more leafy greens often see steadier numbers instead of wild spikes. What surprised me most about spinach is how many systems it touches at once. Vitamin C supports blood vessels and nerves. Vitamin K helps keep arteries from stiffening. Potassium helps regulate blood pressure. Alpha-lipoic acid, a natural antioxidant found in spinach, has been studied for nerve health and insulin sensitivity. So when people say spinach is good for you, that's underselling it. It's more like spinach quietly supports your pancreas, your blood vessels, and your nerves at the same time. And it does it without driving up calories or carbs. The trick with spinach is not to destroy it with heat. Overcooking wipes out some of the most useful compounds. Light steaming, quick sautéing, or eating it raw keeps it effective. Pairing it with olive oil or eggs helps your body absorb fat-soluble nutrients and keeps your blood sugar response slower and steadier. Again, moderation matters. A couple of cups a day is plenty. Too much can cause digestive issues for some people, and if you're prone to kidney stones, that's another reason to balance it out instead of going all in. Then there's broccoli. This one is interesting because it contains sulforaphane, a compound that's been studied for its effects on insulin resistance and inflammation. Sulforaphane activates pathways involved in detoxification and glucose metabolism. In simple terms, it helps your cells respond better to insulin and helps your liver handle sugar more efficiently. Broccoli also brings fiber, vitamin C, potassium, magnesium, and folate into the picture. So it's not just doing one job, it's supporting your metabolism from several angles at once. What most people don't realize is that how you cook broccoli changes how much sulforaphane you get. Boiling it to death is basically throwing away the best part. Light steaming or roasting at moderate temperatures keeps more of that compound intact. Eating it with protein and healthy fats slows digestion and helps keep blood sugar levels flatter after meals. And like the others, you don't need mountains of it. A cup or two a day is enough to make a difference over time. Now, vegetables are powerful, but spices are where things get really interesting. Turmeric is one of the most studied spices in the world, and its active compound, curcumin, has been shown to influence inflammation, insulin sensitivity, and even fat metabolism. Curcumin activates a pathway called AMPK, which is also targeted by some diabetes medications. When AMPK is active, muscle cells take in more glucose and the liver releases less sugar into the bloodstream. That's why some people notice their readings improve after meals that include turmeric. But here's the catch. Curcumin on its own is poorly absorbed. This is where black pepper comes in. Piperine, the active compound in black pepper, can increase curcumin absorption dramatically. That's why traditional cooking pairs them together. Add a little healthy fat, like olive oil or coconut oil, and absorption improves even more. This combination doesn't just affect blood sugar. It also reduces inflammation, supports blood vessel function, and may help protect nerves and kidneys from long-term damage. Turmeric also brings small amounts of fiber, potassium, iron, and vitamin B6 into the mix. Those may sound minor, but together they support circulation and nerve health. Over weeks and months, people often see modest drops in fasting glucose and HbA1c when turmeric is used consistently as part of meals. Not because it's acting like a drug, but because it's lowering the background inflammation that interferes with insulin signaling. Black pepper deserves its own spotlight too. Piperine doesn't just help with turmeric. It also slows certain digestive enzymes and glucose transporters in the gut. That means sugar enters the bloodstream more slowly. Piperine also increases the bioavailability of other nutrients in the meal, so your body actually uses more of what you eat. It's like turning up the efficiency of your digestive system. On top of that, black pepper contains antioxidants that reduce oxidative stress, which is a big deal for people dealing with chronic high blood sugar. What's wild is how quickly spices can have an effect. Some people using continuous glucose monitors see differences within minutes of a meal that includes turmeric and black pepper. That doesn't mean their diabetes is cured. It means the spike is blunted. And over time, blunted spikes mean less stress on blood vessels, nerves, and kidneys. The best way to use these foods is not as some extreme cleanse or rigid diet. It's to build them into normal meals. A stir-fry with spinach and broccoli, a soup with bitter gourd and chicken, roasted vegetables seasoned with turmeric and black pepper, yogurt mixed with turmeric and a pinch of pepper. These are normal foods, not weird hacks, and that's why they work better long-term. Now, I need to be straight with you. None of this replaces medication if you need it. And none of this gives you a free pass to eat whatever you want. These foods work best when they're part of a balanced pattern that includes protein, fiber, and healthy fats. And if you're on insulin or oral diabetes drugs, you should monitor your levels and talk to your doctor before making big changes, because food plus medication can sometimes drop sugar too low. Here's where it gets interesting though. Most people look for one magic food. What actually works is combining small effects. Bitter gourd helps glucose move into cells. Spinach supports insulin sensitivity and blood vessels. Broccoli activates protective metabolic pathways. Turmeric and black pepper reduce inflammation and slow spikes. None of them are dramatic alone. Together, they shift the environment inside your body toward better control. That's how real change happens. Quietly, gradually, and in a way you can actually live with. If you've been frustrated because your numbers won't budge or your belly fat won't go away even when you're trying, this might be the missing piece. Not a miracle, just smarter food choices that work with your body instead of against it. And this is not medical advice. Always check with your healthcare provider, especially if you're adjusting diet while on medication. If this changed how you think about everyday foods and blood sugar, hit subscribe. I break down health science like this every week. Real research, no hype, just stuff you can actually use.